Hello, and thank you for viewing ETSU Family Medicine's video on accountable care organization workflows. Today we will be discussing body mass index screening and the follow-up plan. The ACO describes this measure as a percentage of patients aged 18 years and older with a BMI documented during the current encounter or during the previous 6 months, and with a BMI outside of normal parameters, a follow-up plan is documented during the encounter or during the previous 6 months of the current encounter. Normal parameters include patients age 65 and older with a BMI between 23 and 30. For patients between the ages of 18 and 64, a normal BMI is between 18.5 and 25. The initial population includes all patients 18 years and older on the date of the encounter with at least one eligible encounter during the measurement period. The denominator includes the initial population. The numerator includes patients with a documented BMI during the encounter or during the previous 6 months, and when the BMI is out of normal parameters, a follow-up plan is documented during the encounter or during the previous 6 months of the current encounter. Exclusions include patients who are pregnant or encounters where the patient is receiving palliative care, refuses measurement of height and or weight, the patient is in an urgent or emergent medical situation where time is of the essence and to delay treatment would jeopardize the patient's health status, or there is any other reason documented in the medical record by the provider explaining why BMI measurement was not appropriate. When the nurse takes the vitals of the patient, if a height and weight is documented in Allscripts, the system automatically calculates the BMI. The BMI result will show up in the vital section of the note. If you have a patient 65 and older with a BMI under 23 or over 30, or a patient between the ages of 18 and 64 with a BMI below 18.5 or above 25, you must take action. After determining the patient's BMI, a diagnosis code should be added to the chart. Go to the Problems tab, and under Active, you are going to see a BMI order group. If you are not able to see the order group, click on the Quick List On and Off button, which will then populate the folders for you. When you click on the BMI Adult, you get some BMI choices that you can add to the chart. You can also search for BMI, and it'll give you some more specifics on the BMI. Any of these codes will count for this measure. Be sure when adding an active problem for BMI to the chart that you are also adding it to the encounter form for billing purposes. Now that we have the BMI documented and a diagnosis code added, we must take action for the abnormal BMI. On the RX tab, the Lab tab, and the Instruct tab, you will see a folder called BMI. Clicking on the BMI folder will give you several suggestions. Based on the patient's BMI, you can order the appropriate item, which may include, but is not limited to, documentation of education, referrals, pharmacological intervention, dietary supplements, and exercise counseling or nutrition counseling. Remember, the items that are in this folder are just recommendations. You can order whatever you feel is appropriate. We understand that many of you are already documenting this information in your care plans. Towards the end of the year, we will be doing a manual audit and reviewing your care plans and closing the gap on the back end manually. But also understand that documenting a follow-up plan will close the gap. Thank you for viewing today's video, and have a nice day.